Incorrect lifting is probably, or at least one of the most common reasons that someone needs to go and see a chiropractor. The most common things we see in our office is headache and migraines, neck pain, and of course low back pain. So if you're lifting incorrectly, there's a very good chance you end up in our office. I'm Dr. Rodney White with Sarpi Chiropractic, and today we're going to talk through the do's and don'ts of lifting correctly. Now this usually applies for things that are small and light and easy, because everyone knows if you're helping someone move something heavy, like a heavy piece of furniture, we all know to use our knees, right? It's when we pick up something light, like something like this that's about 5 pounds, it's very easy just to bend the wrong way, but we're going to be in a lot of danger because our low back is most vulnerable to injury, especially the discs in the back, but the entire low back is most vulnerable to injury when we have these three things. Bending forward is already very dangerous if we don't use our knees or hip hinge properly. Then when we hold something out in front of us, not in close, but out in front, and then twisting, that is the three things when combined that are the most likely to cause you to really damage the discs and the rest of your spine. So if we don't want to bend at the waist and we don't want to keep it away from us, how do we do it? Well, for those of you with good knees, pretty simple. We just do a squat, we come down, keep whatever it is close to us, pick it up, keep it to our chest, and we're good to go. Same goes for if you've dropped something on the ground, although some people might not be able to squat all the way down to get even like a pen. So if you can't do that, the next option is more of a split squat or a lunge. You can get in and still keep the thing close. You need some knee bending ability, but not as much as you do a squat. And that one can work really well if you have dropped something like a pen, because you can go and get it without straining your low back. If it's something really small, you can do a golfer's lift. You watch the golfers pick up their ball out of the hole, they lift one leg up, they often lean on their putter or lean on something and go get it. That will keep their back protected. But all of that's great, but for those of you who are watching this who have really bad knees, or maybe you're just very weak with squatting, whether you're a little further in age or you've had bad injuries, whatever it is, we need another option. So if you can't really use your knees very well and all you can do is bend them to about that, we're still too far away, and if I bend, I'm just going to hurt my back. We can do what a good weightlifter does with a deadlift. They don't actually bend at the back to do a deadlift, they do what's called a hip hinge. So they're pushing their pelvis and their hips straight back, and they're actually bending at the hip, not at the waist. So if I do a hip hinge, you can see my low back is still straight, and if I'm closer to the object, now I can still get down, and my knees are a little bit bent, but they're really not much. Even if you have pretty bad arthritis, you can bend them this much, but you can do an even better deadlift and just not do it, and now get it in close, and then we're good to go. Same thing goes now for putting things back down. People do the right lift, and then they just go do this, and they tweak their back. So either do your split squat, both knees, or hip hinge as you put it down. So if you lift that way, you are going to, for the most part, avoid trouble with your back. If you do still suffer with low back pain though, do yourself a favor and go and find a good chiropractor to help you. If you're in the Omaha area, look up Sarpi Chiropractic or our website, sarpicchiro.com. We have a couple locations that makes it nice and easy for you to come in, get assessed, and see if we can help you. We'll see you next time with another health tip.